Mic because the camera finds you. And when you're done speaking, turn it off because otherwise the camera It's I upon you. Are we good on the AV?
I think so.
Uh-oh. The microphone.
No, I just, well, oh,
Open Meeting Act have been met. And I'd like to welcome everyone joining by Zoom or on your YouTube live stream. I'd like to ask now if the board members have reviewed the minutes from the March meeting. And second, have a motion and a second for approving the minutes. Roll call.
Bruce Benjamin.
Yes.
Lisa Kilblane.
Yes.
Suzanne Catoni.
Yes.
Ken Rose.
yes.
Mark Sims.
Yes.
All right, thank you. Now for the chair's report in recognition of this potentially being Casey Kilblane's last meeting. I'd like to recognize her long service as a board member. Casey was appointed by the Superintendent of Education, has represented Congressional District 4 since 2003, when she was appointed to the TSET Board of Directors to fill out an unexpected term. Casey has been a strong voice for TSET's work in rural areas, TSET's work in schools and with youth. She has been a liaison with TSET research grants and an advocate for prevention and health improvement. Her term ends in 2021, and we have been privileged to work alongside her, and she leaves a legacy in the foundation of TSET's work. We have a quick video to honor TSET's time on the board.
My name is Casey Kilblane. I live in Davis, Oklahoma, which is about an hour south of Oklahoma City, right in the heart of the Arbuckle Mountains. Have lived there all of my life except for about 20 years, college and work, and then was able to come back. Sometimes when people ask why I sit on this board, what role, I'm not a doctor, I'm not a scientist, something like that. One of the strengths I feel is that I'm a mom. And there are a whole bunch of moms in this state. And the health of our children is very important. But I think that that's the one role that distinguishes some of the decisions I make, some of the choices, the things I get excited about is what it can have and the effects it can have on the children of our state. It's just amazing how many fingers we have that are spanning the entire state and where it's touching so many people. It's rewarding to talk and hear my own children say, tobacco stops with me. Or, hey, Mom, I saw your ad. Or, hey, Mom, what's this about? So you know that it's beginning to touch that level when they can repeat things back to you. As we look to the benefits of the endowment, that this is going on for perpetuity, the effects that the programs and things that we can have on our children now, but then maybe on my grandchildren and my great-grandchildren as it just continues to go. The endowments and the programs we establish will be here for a long time.
Yeah. Just from my perspective, it's been incredible. Of course, I came on and you took me under your wing and helped me figure things out. And it's just been a pleasure working with you. And I think you've been a real leader.
Thanks. been fun.
Okay, the next item on the agenda under the chair's report is board governance framework, and we'd like to enter a discussion and possible action on the creation of a board governance committee. As we look to the future, we also want to continue to engage in ongoing board development and planning. One of the ways that we can do that is to examine our current board policies and ensure that they reflect our practices. To that end, we proposed the creation of a board governance committee. This committee will work with staff to look at current board policies, relevant structures, and make a recommendation for board manual update to be adopted on or before our May 2022 board meeting. As laid out in the timeline, this committee may meet with an outside consultant retained by TSET to discuss current policies and report out to the board at quarterly intervals. Discussion. In the absence of discussion, we have a motion to approve.
So moved.
Second.
It's been moved and seconded. Roll call.
Bruce Benjamin,
Yes.
Casey Kilbane,
Yes.
Susanna Gattoni. Yes. Ken Rowe,
Yes.
Marshall Sykes.
Yes.
All right, motion passes. Now I'd like to move on to the executive director's report. The chair recognizes Julie.
All right, good morning. Just an honor to have worked with you, Casey. I take a moment. I came on in a staff capacity, and you were always there for great constructive feedback and have continued to be. So thank you for your passion, your service to this board and to the state. And we look forward to what your big next adventure may be. I know you will not go silently. I'm sure we'll see you in some other capacity as we get there. So thank you for that moment of personal privilege. Just an update on the TSET strategic map, as Chairman discussed, looking at board governance as part of the strategic plan adopted by the board in FY 2019. Ongoing board development and effectiveness was highlighted as a goal. This is part of our process doing that is educating board members on programs, providing updates and evaluation reports to ensure that the TSET board of directors are growing in their knowledge of TSET. Another foundational piece of this work is looking at our current governance structure, looking at our statute and constitutional language and how they all fit together. So over the next year, I'll be working with the newly created and yet to be appointed governance committee to update our board policies and framework. And this will also involve working with a consultant, touching base with some previous board members. I know we've talked with former chairman Don Milliken about board policies and practices, and we'll be giving you updates along the way. But if any of you have a good structure that you would recommend or a board that does it exceptionally well, please let me know. It's basically an update, less of trying to solve a problem, but more of making sure that our policies reflect our current practices and priorities. So I will move on to our introduction of new staff. You can see those bright smiley faces there. We have been busy onboarding folks, some virtually and now moving in person. Michael Clark is an accountant at TSET. He graduated from the University of Missouri with a bachelor's degree in business administration, and he began his career in banking operations, working at 2 Fortune 100 banks and a large privately held bank based in Oklahoma. Later, Michael transitioned to public service at the state treasurer's office. He worked in the banking operations division, then served as an accountant in the accounting and portfolio division. And he is very enthusiastic and loves to eat healthy food. So it's been nice to have him on staff. He works with Jennifer. Also, we've hired a new program officer who will oversee our incentive grant programs. As you may recall, Sharon Howard has recently retired. And we know that the other program manager is planning a retirement here pretty soon. Laura Matlock has been in public health for over 10 years. She has experience working with individuals on behavior change, as well as health improvement efforts at the local, county, and state levels. She has a Master's of Science degree with an emphasis in health promotions from the University of Oklahoma. And Laura was also one of the first Oklahoma-based QUIC coaches for Free and Clear, TSET's original contractor to operate the Oklahoma Tobacco Helpline. Next on that list would be Jade Owen. She is a program officer at TSET. As you know, we are also seeing the retirement of Sharon Neal. We'll talk about that later, but Jade is coming in to work alongside her in these last few days. Jade earned a Master's of Public Health in Health Promotion Sciences from the University of Oklahoma Health Science Center. She is also a certified health education specialist. Most recently, she was the Community Outreach Coordinator for the Oklahoma Nutrition Information and Education Project at OUHSC. As the coordinator, she had the opportunity to plan, implement, and evaluate numerous nutrition and physical activity programs, and most recently worked to increase farmers markets involved with the SNAP or the Double Up Bucks from 10 to 48 across the state. She's also served as the co-chair for the City County Health Department's Wellness Now Physical Activity and Nutrition Work Group, Regional Food Bank of Oklahoma's Leadership Council, Oklahoma City Young Nonprofit Professionals Network, and she is an alumni of Leadership Oklahoma City's Loyal Program and has been recognized as the Next Gen Under 30 Award in 2019. And then finally, Alexandra Feld is the EPI at TSET. She has received her Master's of Public Health and Epidemiology from St. Louis University in St. Louis, Missouri, a bachelor's in science in microbiology from Ohio State. And she previously managed the Oklahoma Central Cancer Registry surveillance database at the State Department of Health. She was responsible for facilitating all data requests and research activities utilizing Oklahoma's cancer data. Additionally, she led advisory committee meetings with stakeholders throughout the state, and she has worked in infectious disease epidemiology in St. Louis, where she completed a year-long informatics fellowship from the Centers for Disease Control and Prevention. The new faces. Next, we'll move on to our staff retirement. Sharon Neal is retiring, and I know Jonas Mata, our Director of Programs, was her supervisor, and he's got a few words to say. I hope Sharon's tuning in anonymously. Usually we'd make them be here, so this is kind of nice. You can have your reaction at home or in your office.
Yes, good morning. Just wanted to say a few words about Sharon Neal. She was our first program officer. She came in November of 2006. We've been a professional team for 14 and a half years. In those early and youthful days, we could not have selected a better program officer with whom to grow the grant programs with. It really wasn't easy those first few years, two strong-willed individuals working together, but I always had confidence in Sharon's experience and abilities and I knew I could count on her to finish any task that we took on. She's always been respectful, mission-driven, tenacious, kind, and a true leader. As we added staff, Sharon carried the primary responsibility of onboarding them and mentoring them. And in 2012, we moved her into the first senior program officer position with lead responsibility to oversee the community programs. On several occasions, Sharon has taken additional grantees on for a time-limited basis when program officers have left. And she's also mentored the new program officers that have come on board. She's really been instrumental in creating what I would call first-time grant management and implementation tools. Things like expenditure tracking sheets that she shared with grantees so they could keep track of where they were in their expenditures, as well as we were doing the same thing. Budget sheets to capture local match by grantees. At the very beginning of TSET, we actually required grantees to produce and provide match. Ongoing improvements to our financial procedures manuals. She also developed the parameters for desk audits and financial reviews. He helped develop the performance reports for the Healthy Living Program that you all have been exposed to. Most recently, she's drafted the program management's key metrics document that has served as lead. And she's also serving as lead on creating the framework for the TSET guidance teams working with HLP. So to grantees and staff today, Sharon continues to be a mentor, a team player, connector, advocate, caring listener, and thought leader. She's an icon of quality and integrity, both professionally and personally. Sharon, we are all going to miss you greatly.
Thank you, everybody. Thank you.
Thank you, Sharon. All right, we'll move on to the overview of executive director activities. You can see some of the highlights in the public information and outreach packet, and I know they'll go over those in a little bit. We've reconnected with partners and key opinion leaders this quarter to educate about TSET's programs, talk about the upcoming youth programs and policy goals. And we've had several meetings to include the City of Tulsa, Oklahoma City Beautiful, Department of Ag, Department of Human Services, as well as updating the Health Cabinet Secretary on TSET projects and partnerships. And as we talked about earlier with governance, we have been doing a lot of conversation with various leaders and boards and governance. This quarter also concluded our partnership with the OSU School of Business data analytics class. And that was part of a year-long project to really look at the data that we have around our programs and what sort of questions and conclusions we can draw from that. And it's also part of our goal to increase and better understand the impact that our work has. So this summer we'll have a data analytics intern who has already started, who will work with Lance Thomas on some additional analysis, and also with our new hired epidemiologist to help inform us to move toward in-house management and data analysis around our program outcomes and any trends that the data may show. So we are moving closer to that goal, and it's very exciting. We hope to have some products to share with this board, even if it's just this is what our internal analysis showed. We've also
That is Dr. Beebe has done a lot of that, as well as the folks at OSU that kind of come in and all that analysis of the data.
So Dr. Beebe is our external evaluator. So they look at the program design. There's an evaluation design for the program to say, did we do what we said we were going to do? And are there opportunities for process improvement? So Dr. Beebe will continue to do that. A lot of what this group did over the last year was to look at the other data that we have. How quickly are policies being adopted? What are the hallmarks of successful grants and things like that, to say what other questions and conclusions can our decade of information around more maybe granular outcomes show us, and how could that inform us as a board, as an agency, towards those data-driven decision making. And so it's kind of a complement to what Dr. Beebe and her team will do. And we may not be coming to those same conclusions in terms of the confidence interval or the academic evaluation, but it is really to help inform how much TA did we need to provide to get to this goal. So things like that is what they were doing.
It was more of, looked a lot at internal operations as it related to the running.
That, and also looking at some informal conclusions around how quickly was change made. We've been doing community-based programs now for more than a decade. We have some trend information that we'll be asking questions of and bringing conclusions to the table. Dr. Beebe and her team will still continue to do the evaluation and the overall, but these are sort of bullets or other kind of observations that we would have as a business or an agency doing this work. So we've also engaged in executive planning retreat to discuss FY22 programs and beyond, and we'll be bringing a lot of that material to the retreat in August. And just an update on our work with the Legislative Office of Fiscal Transparency. We have been engaged with their staff since October on their inquiry and overview of TSET. A hearing was scheduled for the first week of May, but was rescheduled. We have seen the draft report and provided our response. The report will likely be made public 5 days before the hearing, which is right now scheduled for June 21st. And so it was an insightful process, a very thorough process as well. So we look forward to the hearing and the opportunity to answer questions of lawmakers.
Was there anything in the report that was really surprising? I'm not asking you to talk about what's in it, but.
I would say that it was an external overview of the programs, but there were no findings that spoke to, mismanagement or duplication of services, but more perhaps the Legislative Office of Fiscal Transparency, understanding the work of prevention and the value of that. And just a quick update, the Board of Directors meeting in retreat is scheduled for August 26th and 27th. We'll be doing that at Lake Murray State Park and Lodge. Please make note to attend both days. We'll do a regular board business meeting on August the 26th and the retreat on the 27th. Topics for the retreat will include a presentation from Dr. Beebe. Also discussion on board governance and future funding strategies. If there are other things that you would like for us to cover or address, please let me know. Any questions about that?
All right, thank you, Julie. Agency operations report. Board recognizes Marshall Snipes.
Thank you, Bruce. The Agency Operations Committee met prior to this board meeting, and we reviewed all of the financial information provided by management, including an update on the current year's progress on our budget, as well as the budget for next year, and we'll be going through those details here. I think all the financial information was provided in your board packets, so you should have all had a chance to look at that, and we would entertain any questions about any of that. But let me just hit some of the highlights. As of March 31st, we had spent 61% of our budget for the operating budget. That's a good spend rate for the end of the third quarter and is right on target. Our budget to actual for our program budget was at 51%, which was a little low, but it's a good spend rate for the end of the third quarter because a lot of the invoices haven't come in yet. And a lot of the, especially in the research area, we get those bills in the fourth quarter. So nothing to worry about there. We do have some budget revisions for the FY21 budget for items that are not going to be spent. $75,000 reduction in the grant management system that did not happen in FY21. And I think when we move over to the FY22 budget, I think it shows up there. So that just got pushed into a different fiscal year. And then a $10,000 reduction for conference room rentals, our staff retreat, and staff development that will not happen in FY21 because of COVID. So I'll pause there. Any questions?
I thought we were done with grant match. Yeah, that's the gift that keeps on giving, isn't it?
I believe the restrictions have expired when the emergency declaration was rescinded or made over. So we may have some travel that returns, and this is, the first time we're all here in person. So it's kind of the dawning of a new day.
The program budget for the year, we're proposing a reduction in that budget of $1,148,000. And that detail is also in your packet, but just generally, the lapses for the grantees that will be recaptured were due to COVID restrictions during the year. The OSDH reduction of 400,000. We moved around some money from the helpline to the Tobacco Stops With Me campaign. There was an $850,000 reduction for emerging opportunities that did not get off the ground in this past year, again, due to COVID. There was a $330,000 reduction in incentive grants for unawarded funds, a $202,000 reduction in the Healthy Living Program 2.0 grantee lapses, and an $88,000 reduction in the evaluation contract. These budget items will help us achieve our goal of 95% spend rate for the year. So the Operations Committee recommends adopting these budget revisions for FY21, and that would be in the form of a motion, Mr. Chairman.
All right, thank you, Marshall. The Agency Operations Committee recommends a reduction of $85,000 from the FY21 operations budget and a reduction of $1,148,615 from the FY21 program budget. This came out of the committee, does not require a second. Roll call.
Bruce Benjamin,
Yes.
Yes.
Susanna Catone. Yes. Ken Rowe,
Yes.
Marshall Sykes.
Yes. Okay. We also are asking for an approval for FY22 budget. And that information is also in your packet. The program or the operating budget of 1.9 million and the program budget of 47.9 million does restore some of the cuts that we made last year. The Operations Committee has reviewed the 3-year moving average. We have reviewed the amount of money that it looks like we're going to get certified next fall. And we are comfortable that restoring those cuts is appropriate at this time. And you can see the detail in your packet, but just generally speaking, the operating budget was 1.9 million. That was $30,000 associated with fringe benefits for up to 5% salary increases for performance, and an increased travel budget for conferences where appropriate, $110,000 increase for website redesign, and $75,000 increase for grants management that I mentioned earlier was moved from the prior year. The program's budget of 47 million was an increase of approximately 4 million from the FY21 budget, and that includes $40,000 for up to 5% salary increases for performance, an increased travel budget, the ramp up of Healthline, of Healthy Living Program 2.0 of 2.5 million, and restoring the research budgets to full funding after the cuts that occurred last year. So it is the Agency Operations Committee recommendation that we approve these two budgets for FY22.
Bruce, before we do that vote, I should remind everyone to turn on your mics when you're asking questions or voting so that everyone can hear you.
All right. Thank you, Marshall. So then in summary, the Agent Operations Committee recommends an FY22 operating budget of $1,920,953 and an FY22 programs budget of $47,937,936. Came out of committee, no seconds required. Roll call.
Bruce Benjamin,
Yes.
Casey Kilbane,
Yes.
Susanna Catone,
Yes.
Ken Rowe,
Yes.
Marshall Sykes.
Yes.
Marshall.
Okay, so as I mentioned, we did look at the analysis of reserves and our 3-year rolling average, and all of that is intact. We've had a good year so far in our earnings from the Board of Investors, And that performance, of course, the year's not over yet, but that performance, at least to date, gave us comfort that these budgets could be restored to their previous levels. And we're very comfortable with that. As we all know, markets fluctuate and those numbers could move around, but I think we've got a significant enough head start on our comfort level that absent some sort of catastrophic event in the next couple of months, we should be just fine. So that concludes my report.
Thank you, Marshall. The next item on our agenda is the Programs Committee report, and the chair recognizes Jonas Mata.
Hello, there are quite a few details in the packet. The COVID impact on grant programs really is, starts on page 28 of the packet. And I'll just go over some general effects. Delays in projects completed around the incentive grants programs in terms of what was awarded. And then I think our completion is within a year, and that's been extended. And then with our healthy living program around data gathering. Cancellation of, site visits to the field because of COVID, scheduled extensions of activities results. We're hopeful that we have the assessment results for healthy living by April, March, and they're going to be due around in June, and grantees will start prioritizing. Reductions in applications or referrals received, both for the incentive grants and for the Oklahoma Tobacco Helpline. And then staffing and time assigned to work, the pandemic. So the Oklahoma Department of Health and some of the local county health departments had staff that were assigned to work COVID. And of course, the CARE Act reimbursed them for that time. Second report is the lab summary. Major reasons, again, that's on page 30. Limited travel and conference. Marshall mentioned some of these things. Lower spending in health communications due to fewer events and sponsorships. CARE Act reimbursements of grantee staff, and then unspent funds due to unfilled staff positions or vacancies. Hence, significant delays in hiring. Third item, discussion and possible action on increased FY21 VI contract. This was mentioned earlier. It's at the bottom of page 30, after page 31. During the pandemic, nationally, most helplines have seen about a 25% drop in registration volume. We have seen only a 10% drop. With lower registrations, of course, the service contract reimbursement is lower. So rather than lapse the dollars, we're recommending a transfer of $400,000 to VI to amplify the tobacco helpline message through targeted TV and cable for the sooner care population. So this recommendation is coming out of the program committee.
All right, thank you. We have a recommendation out of the Programs Committee for a vote. No second is required. Roll call.
Bruce Benjamin,
Yes.
Casey Stillwell,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
Chair recognizes Tessa North, Director of Grants Management, for the next 4 agenda items.
Great, thank you. So Rescue, we have a contract with Rescue during FY21 for our youth advocacy program. They have recently indicated that work on 2 policy campaigns is still ongoing and that campaign development will not be completed by the end of FY21 as they originally anticipated. They do expect that the work on the tobacco policy campaign can be completed by the end of July, and that the campaign on nutrition and physical activity could be completed by the end of August. So this timing poses no programmatic issues, as youth trainings typically don't begin until the fall once students are back on campus anyway. And all other work associated with the contract is going to be completed by June 30th. Rescue estimates that about $50,000 from FY21 would be unused by the end of the contract on June 30th until the work of these 2 campaigns has been completed. So we are recommending a 3-month extension of Rescue's FY21 agreement, which would move the end date from June 30th, 2021 to September 30th, 2021. The FY21 contract would then run concurrent for 3 months with their FY22 contract if the board approves it. Programs Committee recommended approval of this 3-month no-cost extension for Rescue's FY21 agreement.
Okay, thank you. This recommendation does not require a second. Roll call.
Bruce Benjamin,
Yes.
Casey Kilblane,
Yes.
Susanna Gattoni. Yes. Ken Rowe,
Yes.
Marshall Snipes.
Yes.
Great, thank you. So, okay, thank you. Sorry. Next on the agenda, we have consideration of FY21 Healthy Incentive Grant Awards for schools. The Programs Committee recommends award of 2 incentive grants for schools for a total amount of $9,000. Because this came out of committee, no second would be required. And the organizations that are under consideration today are Bradley Elementary in Creek County for $3,000, Coolidge Elementary in Oklahoma County for $6,000. So that's your total of $9,000. Are there any questions about these 2?
All right, in the absence of questions, roll call.
Bruce Benjamin,
Yes.
Casey Kilblane,
Yes.
Susanna Gattoni. Yes. Ken Rowe,
Yes.
Marshall Snipes.
Yes.
Thank you. So the next item we have is our Healthy Incentive Grant Program for districts. Again, we have 2 applications that TSET is recommending for award for a total amount of $18,500. Under the districts program, we have Worcester Public School in LaFleur County recommended for $3,000 and Blanchard Public Schools in McLean County recommended for $15,500 for your total of $18,500. Are there any questions about these 2 applications?
All right. Since this came out of committee, no seconds required. Roll call.
Bruce Benjamin,
Yes.
Casey Kilblane,
Yes.
Susanna Gattoni. Yes. Ken Rowe,
Yes.
Marshall Snipes.
Yes.
Thank you. So our final incentive grant today is for communities, Healthy Incentive Grant Program for communities. We have recommended the award of 1 incentive grant for the town of Cedar Valley in Logan County for a total amount of $10,000. Any questions about this one?
Roll call.
Bruce Benjamin,
Yes.
Casey Kilblane,
Yes.
Susanna Gattoni.
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
Thank you. So our next discussion item today is for a request to continue our TSET's agreement with the Oklahoma State Department of Health for the Center for Chronic Disease Prevention and Health Promotion. FY21 marks the final year of our current multi-year agreement with OSDH and the center to provide technical assistance, product development, coordination, training, and general support services to TSET, our grantees, and our partners. We're seeking a new 3-year continuation agreement at an amount not to exceed $964,952 for FY22. If approved by the board during the annual renewal process in future years, subsequent years funding requests are not expected to exceed $934,029 in FY23 and $933,204 in FY24. The Programs Committee did recommend approval of this 3-year continuation agreement with OSDH for FY22 for $964,952. Are there any questions about
Tess?
our agreement? Yes.
Yeah, Tessa, why do you anticipate the reduction from 23 and 24?
Great question. So when OSDH submitted their budget request for FY22, we had them also submit a budget request for 23 and 24, and those were the numbers they came up with. So I don't know if they foresee less staff time needed. We just had them, they have to do a detailed budget for FY22 and just an estimated summary type of budget for 23 and 24.
It's just a nice thought.
So-
They're going to reduce, not increase.
Right, yes, yeah.
I mean, that's very novel.
So we just approved the fiscal year 22 budget.
Correct, that, yes,
So
yes.
We did that already, and these other 2 years are not approved. We're not approving those. So I still get confused when we have a 3-year, we call it continuation agreement, when we really aren't funding it until we approve the budget in the future. So it could go to 0 in 23 and it could go to 0 in 24 theoretically. I know it probably won't. So how does that square legally with the fact that are we signing a 3-year continuation agreement?
I isn't it contingent on funds being available? It's not
Okay, I just
actually
want to make that
saying we're,
clear.
yeah.
Correct. So, Marshall, just so you are aware, every year when a grant is ending its multi-year agreement period, we make them start all over with a whole new like proposal and application. So by entering into a 3-year agreement, they wouldn't have to do the whole, proposal every year. They would do it. Next year would be just like a budget request and new work plans, whereas in FY25, if they're approved for 3 years now, in FY25, they may come back with a full proposal. again.
So are these 3-year programs? 1 year depends on the prior year from an operational standpoint, or is this all just financial?
It's just fine. So this particular one is just services that they're going to provide in FY21. So it's just financial.
Okay, I'm good.
All right. We have no other questions. Roll call.
Bruce Benjamin,
Yes.
Casey Kinley,
Yes.
Susanna Gatelli. Yes. Tony Rowe,
Yes.
Marshall Smith.
Yes.
All right. The next item I have for you today is consideration and possible action on FY22 grant and contract renewals. These are all listed in your agenda. The budgets listed here represent the maximum funding amounts requested for FY22. The programs committee considered and recommended for approval the slate of grant and contract renewals that are listed here in your budget. And I believe I'm going to read them all for you.
Yes, please.
All right, starting at the top. Change Lab Solutions requesting $190,000. Emory University, $175,758. Oklahoma Department of Mental Health and Substance Abuse Services, $583,744. Oklahoma Healthcare Authority, $270,231. Oklahoma Healthcare Authority cost share for Sooner Quit, health communications cost share, $2 million. Oklahoma Hospital Association, $593,075. Oklahoma Medical Research Foundation, $3 million. Onside Partners, $120,000. Physician Manpower Training Commission. This includes the medical loan repayment program and program administration, $688,710. Rescues Youth Advocacy Program, $1 million. Rescues Youth Media and Marketing Program, $1.5 million. Tigress LLC, $50,000. University of Oklahoma Health Sciences Center for Program Evaluation, $1,585,000. University of Oklahoma Health Sciences Center for the TSET Health Promotion Research Center, formerly OTRC, $3.8 million. University of Oklahoma Health Sciences Center at the Stevenson Cancer Center for the TSET Cancer Research Program, $5.5 million. BI Marketing and Branding, $12,620,000. And then all of these next ones I'm going to list are under the TSET Healthy Living Program. We have the Atoka County Health Department for $118,000. Bryan County Health Department for $128,500. Canadian County Health Department, $190,000. Cherokee County Health Services Council, $203,400. Cherokee Nation Serving Adair County, $200,111. Comanche County Memorial Hospital, $260,000. Gateway to Prevention and Recovery Serving Pottawatomie County, $220,000. Grant Nation Serving Craig County, $215,000. Great Plains Youth and Family Services Serving Caddo and Kiowa counties, $157,838. High Boys Community Action Foundation Serving Haskell County, $141,000. Kingfisher County Health Department, $176,788. LaFleur County Youth Services, $198,000. Lincoln County Health Department, $190,552. Marshall County Health Department, $118,000. Mays County Hope Coalition, $212,587. McLean Garvin County Youth and Family Center Serving Garvin County, $183,000. McCurtain County Health Department, $123,000. Thank you. Muskogee County Health Department, $258,781. Norman Regional Health System serving Cleveland County, $246,053. Norman Regional Health System serving Grady County, $260,000. Norman Regional Health Systems serving McLean County, $172,965. Nowata Can serving Nowata County, $130,000. Oklahoma City County Health Department, $400,000. Oklahoma State University serving Creek County, $260,000. Oklahoma State University serving K County, $190,000. Oklahoma State University serving Payne County, $260,000. People Inc. serving Sequoia County, $205,000. Pittsburgh County Health Department, $125,000. Pontotoc County Health Department, $182,060. Pushmataha County Health Department, $116,000. Rockmond Area Youth Services serving Delaware County, $216,074. Rogers County Volunteers for Youth, $255,277. Rural Health Projects serving Garfield County, $260,000. Tulsa Health Department, $400,000. And Wichita Mountains Prevention Network serving Carter County, $147,799. That concludes our list of contract and grant renewals.
All right. Thank you, Tessa. All right, thank you.
Thank you.
First, a couple of things on item C, the Oklahoma Department of Mental Health and Substance. I believe that amount is 583,774. I think we said 44 instead of 74.
Oh, sorry.
Yeah.
Yes, it is for Oklahoma Department of Mental Health, 583,774.
And then just to point out that item G, Oklahoma Medical Research Foundation, that is for OCASCR, the Oklahoma Center for Adult Stem Cell Research, for $3 million.
All right. The chair recognizes Jonas Mata, Director of Programs, who will provide a quick overview of the next several items.
You need to vote.
Do we?
You need to vote on.
And then I know PMTC I have on my calendar, and I think I forwarded you those invites already as well. Let's see.
Clearly streaming us and multitasking. You need to
So
go
we-
to your.
So I'm trying to.
Yep.
Okay.
You need to vote.
I got ahead of myself. The grant and contract renewal requests are listed in the agenda, and of course, we've just read them. The budgets listed represent the maximum funded requesting for FY22. Program committee, of course, makes these recommendations, and since it's coming out of committee, does not require a second. Roll call. No. For Marshall.
We can do a quick report and then come back.
We have enough.
We do have 4.
Let's proceed. Yes.
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 Okay. Marshall Snipes has stepped out of the room for the moment. All right. Now I think I can recognize on this.
We have a series of reports to go through, and I'm going to try to summarize them as you go through this. So the Healthy Incentives Grants Evaluation, the first thing I want to say is that going forward, we're going to make this a year-long program. So we're going to alternate communities and school open periods, because in the past, we finished up the program early, as funds have been awarded early. So that's just the first thing. It's not going to change the criteria. It's not going to change the requirements. The evaluation for the healthy schools, just a few highlights here. It's found on page 37, 38, the packet. Most of the schools found school districts' common wellness policies as well as the tobacco policies to be fairly easy to implement. And so that's a good thing. I think the USDA requirements for schools, which are federal requirements, were more difficult than our own policy requirements. Just about half of them reported high impact on programs creating healthier environments for students, and 60% associated with healthier behaviors among students. Enforcing tobacco and vape-free policies, of course, is always difficult, especially when you're having to do it for parents and visitors. cafeteria and concession stands at least offer some healthy choices, but overall, we still have major progress in that area to be made. And using, beverages and candy and those kinds of things for benefits and reward is also something that consistently occurs in schools. So that's the school report. The communities report involved about a third of the awards for FY19, and these are all a year later because obviously the projects have a year to end. So on the community side, 85% of the communities obviously believe that a healthy lifestyle was important for them. 2/3 indicate they don't have the proper either equipment or physical activity options such as walking or sports clubs, local parks, that kind of thing. 3/4 seem to indicate that they had a walking trail they could use for walking or running. And we have funded some splashboards and some park equipment that apparently is used quite a bit. Over half the communities have farmers markets and community gardens. They have sidewalks also, yet 38% of the members say they really don't have a local grocery store. Obviously, they have a convenience store, but not grocery stores. A third of the communities felt it was safe and convenient for children to walk to school or bike. No one found the adoption of, again, tobacco-free ordinances to be difficult. And they indicated, at least a third indicated that they reduced secondhand smoke. So the implementation of wellness policies for employees encompassing tobacco, physical activity, and nutrition varied, but overall, I think the implementation kind of shows that it was fairly easy to implement those policies. And the perceived impact of the employees on the employees' health was high. Any questions about those two reports? Great. All right. I'm moving on to the Physician Manpower Training Commission summary. That's page 46. The commission partners with us to address Oklahoma's physician shortage and medically underserved parts of the state. Because physicians after the residency commit to practicing up to 4 years in a rural location. And that amount that to get reimbursed for is $200,000 overall after the 4 years. Since 2013, 46 doctors have participated in the program. 46 doctors have participated in the program. And, over the majority, 54% have agreed to stay either in the location or in another rural location, which is one of our major goals. They've conducted more than 387,000 patient visits, and that includes about 110,000 sooner care visits. According to the American Medical Association, a physician in Oklahoma supports about 12 jobs with an average of 1.9 million in annual economic activity. In FY21, 38 doctors were placed in 24 counties. And there's a map showing placements in your packet. Any questions on that? Great, we'll keep moving. The external evaluation summary of TSET funded programs, page 48 in your packet. The University of Oklahoma Hudson College of Public Health has served as our external evaluator since 2003 with the launch of the helpline. They currently evaluate 7 of our programs. As the information in your packet indicates, they've collaborated with several local and national partners to implement TSET's evaluation activities. They've also engaged in opportunities to disseminate evaluation findings and bring national attention and recognition to us through peer-reviewed publications, et cetera. So the details of the Hudson College of Public Health scope of evaluation work for each of our programs is in your packet. I'll move on, if there are no questions, to the Oklahoma Department of Transportation TSET program update. That's page 59 in your packet. At the January meeting, you all heard from us about an option to work with the Oklahoma Department of Transportation to really launch our portion of the Emergency Opportunities Grant Program, $420,000 to build, to fund built environments, best practices around cities. We chose to work with them obviously because they've been a partner with us in the incentive grants program, and they've used our incentive grant programs to leverage points for the grants that apply through the Transportation Alternative Program. We just wanted to pass through our dollars to them and have them manage them. Our preference really was to fund small cities and towns, 5,000 population or less. And those towns are usually eligible for substantially less funding. They receive fewer funds, and they often do not have the multiplicity of funders that larger towns do. So they brought forward 4 projects that we brought to the table for you to consider. During our negotiations with ODOT, it became clear that ODOT did not want to manage programs as we wanted them to. So considering this new information, we have not moved forward with developing a contract with ODOT. And we are needing additional time to enhance the guidelines created for the program.
Having a really hard time hearing
Okay, I need to speak up.
you. Yeah.
I'm sorry. So with ODOT, our interest was in them having to manage our emerging opportunities program. And they didn't show that same interest. And so we're coming back to you. And we're going to take a look at our guidelines, and we're going to bring back a recommendation to the board. Either we work out an arrangement with ODOT, we look at a separate program, or we establish a request for proposals kinds of process. And so that's what we're proposing today, just giving you the update. Any questions?
Forgot the history on this. I remember having a discussion. What were we thinking? I know that.
We were thinking that they vet their programs through the Transportation Alternative Program. And so they typically fund small and large cities and towns. And so when we approach them, because our incentive program has been a match for them, we thought it'd be a fairly easy process to take their vetted program, so we wouldn't have to do all that upfront work. And then see which of those would be eligible or would volunteer to consider our dollars to supplement the project, because they don't always get funders for the full project. And they sent us 4 projects. They were all in rural areas. And when we first started our discussion with them, it was about, we have some money that we'd like to give to you all through a contract to have you manage those programs. It would be additional money, and it was brought to the board, and there were specific amounts. And they said, well, that sounds good. But when we went back to them, they said, we've considered this, and we don't want to manage the entire program. We don't want you to just pass through your money through us. We'd like for you to manage those programs. So it puts us back in a position of having to do all the work. So the question is, why, under what circumstances should we work with ODOT versus just doing our own process? We could, for example, use their vetted programs and then contact them directly and say, we'd like to fund an additional portion of your project within these guidelines. So we'd have to develop our own application process. And that's what we're considering at this point.
They come to us? and
No.
request this, or did we go to them?
We went to them. We went to them. And we started working with engineers, and engineers typically, I mean, they vet the projects. They're not interested in managing the projects fully. They rely on contractors to do that at the local level. But we talked with their program staff first, and then eventually got to the engineers, and that's when the challenge came.
So are they not going to continue their program?
They'll continue their programs. It'll just be at the level that they fund them. It doesn't give us an opportunity, or the local city or town, an opportunity to add additional funds to complete more of the project. For example, if they're doing a safe route to school, they may only be able to do a mile of the sidewalks when they were proposing to do 2 miles. And probably do that sidewalk closer to the school than away from the school.
So that just really doesn't make a lot of sense for them to say no. I mean, if they're going to continue with that, I mean, have we not talked to the right person?
Well, so for our funding, we require wellness policies to be put in place. And I think that there was a meeting of the minds in terms of these projects, these TAP grants are federally funded and seek to improve or increase walkability, which is in line with what we are doing through some of our programs. I think where we maybe diverged paths was asking ODOT to do the technical assistance on the policy adoption for some of these communities. And so that's kind of where we're coming back and saying, if we're going to be assisting communities with walkability and also have the expectation that they're passing ordinances, that's more our expertise. Their expertise is definitely in building roads and evaluating those projects to say, this is going to be structurally sound. And so it could be that we are partnering, using them as a consultant to say, here are some built environment projects. Do they meet the muster that they need to for your standards? Or the other alternative could be that one of the things that we have for the FY22 budget is a built environment category where people will write a proposal and say, this is what we are planning to do. We understand that we will need to have municipal policy to support tobacco-free.
What was the range of our contribution?
We have not exchanged cash. I think when we,
What were we thinking about?
it was 450,000.
420,000. I think the range was around 50,000 to 190,000 across the 4 projects.
And so we were gonna have them enforce our.
Yeah.
So they didn't want to mess with that.
Yeah, and it was really to assist smaller communities that had already been qualified to receive the federal funding. Ours would have been kind of the bridge funding perhaps for completion, so that a project would then absolutely increase walkability and be used. And I think it is, you know, they're definitely experts in transportation and walkability, and we're experts in wellness policy. So we either find a shared space on that, or we can potentially use them as a, you know, a consultant if we want to help them, have them help us vet built environment projects. We have a good relationship with them. I think this was a good learning experience to see kind of how we could hopefully combine, and we'll keep on moving.
It just reminds me of when we decided we would start research programs, and we had the groups all come and everybody, and then we stepped back and said, no, wait, you know, how can we work together? And I just, if we take it on, it's going to be less that they can do than if we can somehow add our money into what they are doing. And I just look at it from a small community's perspective, you know, I mean, what the additional money to finish our sidewalks would have been incredibly helpful. And if it's us just coming up and following through on the policy side of it, I just think it'd be a real win if we can get out of that evaluating what sidewalks need to be made and all of that planning. And then they say, in addition, if you want additional money that might could fit, this is what you would need to do. And it's the policy side where this money would come from. And then you'd work with TSET some way.
And that is one of the scenarios that we've talked about, is having ODOT be sort of, you know, the funnel. You've gone through this process, you've qualified for this. If you're interested, here's another opportunity that has some different requirements. So that is among the options that we're considering. The goal today was just to update you that we told you we were going to do something in this fiscal year, and we're still working on it. So no funds have been exchanged, and we don't have a contract with them.
Yeah. It would be neat to have the partnership. I mean, it would be a neat deal.
Yeah, I think what it means for us is that we'll have to develop our own application process and reach out to those vetted programs and say, we have some additional money, we have some policy requirements. Are you interested? And if you are interested, we're not interested in funding. We're not interested in reimbursement, because that's one of the things that folks asked us. Can you reimburse us for money that we put in? And we said no. But we are interested in expanding your already approved project. And let's talk about that. Okay. All right, item K, page 61. This is the Rescue Youth Advocacy Update. The accomplishments to date so far, and you can see some of what's on the screen there is a brand name, y'all, Youth Action for Health Leadership. It fits with Oklahoma. And then a logo and a style guide for you to see how it sort of fits together. The next thing that we did with them was a policy analysis landscape on the tobacco side. And
One quick question.
Sorry.
Where's TSET on that?
well, this is,
We've got the,
all of what we've got is a program of TSET, should say a program of TSET. The latest, the latest guides and brands have a program of TSET on all of them. So
Yeah, the one pager has the TSET Healthy Youth Initiative logo down in the lower right-hand corner.
And on the website, it now has a program of TSET under the y'all. This was a stage, this is a draft version. We updated it in the next version.
Okay. Okay. I just hate to lose that because we just, how many retreats have we gone through on that one? Yeah, yeah. I mean, because I like it, but it just, there's no identification that that's TSET at all.
well, we took care of that, as Sana said. Everything includes a program of TSET on it. So the next step was, excuse me, was to do a tobacco policy landscape. And in your packet again, there were 5 areas: comprehensive clean indoor air, banning menthol and flavored cigarettes, and tobacco and nicotine, repealing preemption, comprehensive tobacco retail licensing, and then prohibiting smoking in cars with children present or minors. And we selected to work on the comprehensive tobacco retail licensing. That's efforts to increase ordinances and policies around fees and laws, as well as laws that include vapor and emerging products. So limiting youth access to tobacco and vapor products is going to be part of our campaign now. It'll have an education and training component on preemption because that's the basis of everything that we do here that gives youth a solid grounding and understanding of the impact preemption has had on our tobacco-free work here in the state. So items that we need to include in the future are a website, which we're working on right now, youth recruitment materials for the fall, creation of a youth social media channels, and then youth recruitment video, which I think they just sent us today. And then looking ahead, you can see that on page 71, just the next steps that provide a picture of what's coming. Any questions about that? They will start recruiting clubs and students in the fall. Okay, we will move on to the Healthy Living Program.
Julie, what happened with that? The state was getting involved in branding and telling us we were gonna have to change our brand.
Yes, the state is still undergoing their comprehensive rebranding. So you've probably seen that logo with the chevrons. We are continuing our work and our brand and kind of having conversations with them about what that looks like. And you'll probably see that more bear out as we do our website redesign. That's where you're seeing a lot of agencies come into the new branding. And that's scheduled for us for FY22. I think with the program brands, it is necessary to be specific around TSET. So we will continue to navigate that, knowing that this board is supporting the brand equity that TSET has grown over time, that's a priority to you all. I hear that.
We'll move on to the Healthy Living Program summary. So you all know that our current program is data-driven. There's a comprehensive needs assessment process. And so because of the pandemic, even though we were trying to finish that process by April, we had to extend it 3 months, and we came to you with that request at the last board meeting. So given that 3-month extension, we asked all grantees to put together a progress report. And so what you've got in your packet is sort of a listing of where grantees are with some of the work they've done. You know, grantees have learned that there are local resources they can tap. They had to make adjustments in in-person communications and go virtual. And so we had to train them on that. Policy needs around food access for both children and elderly came up to be a big issue in many jurisdictions. There's quite a bit of resistance in some cases to policy change, either due to the pandemic or just feelings like if I make a policy around smoke-free, I'm going to lose profit, that kind of thing. That still pervades some of the work that's done across some of the restaurants and organizations. We have a local collaborative group that provides community input, and they've been successful in making sure the membership is diverse and representative of the community. So that's another sort of finding that they brought forth. And they also found that there are organizations like childcare facilities, food assistance programs, senior nutrition centers, of course, our tribal nations and housing authorities that are very willing to share their resources and work with them. So they mentioned the OSU Cooperative Extension at the local level, Agency on Aging, farmers markets, all of those. So it's opened up their eyes about what can be done in tobacco, physical activity, and nutrition. And then we also provided you with an example of what we call a high-level strategic map, which gives the grantees an opportunity to see how their data, their findings, can change rates of obesity, tobacco use. So that's provided, I think, it starts on page 75. And then some of the findings they expect to have, they gave you a summary of sort of a city example, both on the physical activity and nutrition side and the tobacco side. Any questions on that? The final is the Oklahoma Tobacco Helpline Quarterly Report. We'll be bringing this to you every quarter, and it just provides an overview of major activity. That's on page 82 of the packet, related to oversight operations, helpline services, and referral activity. Exposure to the tobacco helpline is a model of population-based cessation services, and they have a couple of quality improvement programs that they've listed in their packet. I know it's a lot to take in. It's a lot to produce. Thank you.
Public Information Outreach Committee report. Casey.
Thank you. And we're going to turn it over to Sana to go over our communication purpose from VI.
Hello, everyone. I don't have to turn on a mic or anything, right?
You're good.
Okay. Brands and our spending for both adult and youth programs are going according to our plans and hitting all of our benchmarks. We have several cross-sectionals out in the field right now. We have the Tobacco Stops With Me one out. We're having a little bit of difficulty getting responses. It was going really well at the beginning. Now it looks like we might not be finished until late June, early July on that one. And our Shape Your Future one has just gone out into the field. It has a little broader audience. So we may be able to move that one a little quicker, but we're hoping that it will finish in July as well. For Tobacco Stops With Me, one of the new productions that we're doing is we're taking our Tobacco Stops With Me 7 policy goals, and we're doing an animation educational video for each one of those goals that haven't been met yet. So we're concentrated on preemption and clean indoor air. We should have those finalized in the next couple of weeks and be able to support our efforts on preemption and clean indoor air coming this next year. We have a new Mario Brothers style 16-bit commercial that we're doing for Oklahoma Tobacco Helpline. During the pandemic, we couldn't do filming like we normally did with actors or with testimonials because we didn't want to risk anyone's health. So we went to this animation style. It's super cute. We've seen it. And we're excited to show it to you in August before, hopefully. But it's a little game changer for how we get the message across, and we're targeting our under 40-year-olds with that one.
Do they know who Mario is?
They do. There's a whole bunch of the,
Right.
right.
Mario Brothers.
They're doing this whole retro game, 16-bit thing. So like in bars and clubs, you have the Pac-Man games and all of that. It's all coming back. It all comes back around, doesn't it? And with as Medicaid expansion rolls out, we are providing our helpline logos and information to all of the new Medicaid serving insurance companies so that they get those into their member guides and everyone knows that the helpline is a resource for them. We're continuing our monthly blogs for Shape Your Future and Tobacco Stops With Me. We've had some really exciting little interviews with people. So hope you check those out. Our free materials for My Life, My Quit are up and available now. So we're really excited. We're starting promotion on all of those. And we still have ours available for Shape Your Future, Oklahoma Tobacco Helpline, and Tobacco Stops With Me as well. We did send out a press release this month that went out about those as well. And the TSET podcast is out with interviews on our rural food access grants, and they are heart touching, and you guys have to listen to them because this one will get you. This one will get you. And the next one we're working on is why we do prevention. And we have our first national interview with Dr. Schroeder on that one. So we're excited about that. For our health communication youth focused brands, the second message package for our Swap Up nutrition campaign launched on May 10th. And because of some cost savings on the VI side, remember this is a rescue and a VI collaboration. We were able to get 2 extra weeks of radio and TV on this launch. So we're excited about that. And the website is updated, swapupok.com, with the ads if you want to see them. We're waiting on our final report for our second tobacco message, but in this one we did vape for rural and we did smokeless for youth. And at the midpoint, we saw 16,000 more message views at the same point in time on our smokeless messaging in the rural community as we did on the vape messaging in the rural community. This is a definite area that we need to keep engaging on and move the needle on to help change how people view smokeless tobacco in the rural communities. They just think it's part of their culture, and we have to flip the script on that to help reduce tobacco use in the rural areas. So we're excited about seeing that, and we had a lot of comments on from teens saying, "Hey, this is who we are," and it's like, how do you switch that? We have seen the Swap Up 4th and 5th commercials that were shot. They are spot on. Hardly had any editing. We were very excited about that. Those will preview at the beginning of FY22. And our 1-year follow-up for tobacco with our teen youth is in the field right now. And obesity follow-up will happen in June. And for our OK in the Know platform with our peer-to-peer and learning management platform, we have a satisfaction survey out to measure everything.
Thank you. Any questions for Shauna? Communications. Okay. Thomas is going to walk us through our outreach updates and what's going on with Capitol.
All right. I'll start with the legislative update. Maybe the most pressing issue right now is that there is a bill, Senate Bill 1078, that was amended in committee on Monday, passed out of the Joint Appropriations and Budget Committee, was heard by the Senate on Tuesday and is on the floor agenda this morning. And as amended, that bill that had previously had nothing to do with tobacco would change some tobacco definitions. Specifically, it would pretty narrowly define what smokeless tobacco is in a way that might exclude some of the emerging products like the nicotine pouches, nicotine toothpicks, dissolvables, those sorts of new products. It would exempt them from taxation. So that is concerning. I know that our partners, Heart, Lung, and Cancer, people have been talking to lawmakers. We've been putting some information out there, so we will see. But as of this moment, it's on the House agenda. They've not taken it up yet this morning, so we will continue to monitor that. Elsewhere, so some good news. The Governor Stitt signed Senate Bill 89. That's the health education bill that we also talked to lawmakers about, and that will just ensure that that kids pre-K through 12th grade get health education periodically throughout their time in public school. House Bill 2511 by Representative Kennedy, that requires vape manufacturers to provide proof to the Able Commission that they are working on going through FDA approval process. So that will bring some more accountability to the vaping industry. And also Senate Bill 391 that will benefit the Health Promotion Research Center. That provides an exemption to T21 for research. Now, of course, they will not be giving nicotine products to people under 21 who were not already using them, but they have several studies and research grants underway, and the new T21 law kind of put some of those in danger because some of their subjects fell in between 18 and 21. So this allows an exemption for research there. But there's a full legislative update in your packet. I would just say outside of TSET related things, the governor and the legislature came to announce a budget agreement on May 13th. The budget deal increases education funding. It puts $800 million into the state savings account, cuts corporate and personal income taxes, and on average, state agency budgets will increase by around 7%, but a lot of that is restoring what was cut last year. So the House passed the budget on May 18th, and it's waiting a Senate vote now. Any questions about legislation? Okay. All right. So just some outreach highlights from the last quarter. TSET provided district and county impact pages to Oklahoma lawmakers, and we saw good engagement with those emails. In the past, we have printed all of those local impact pages out and put them in dashboards and hand delivered them. This year, we developed an email that targeted lawmakers and allowed them to click through to see the TSET's impact in their districts and in the counties they represent. TSET staff, we also continue to update lawmakers about new grants in their districts and discuss pending legislation such as health education. As a part of National Public Health Week 2021, Julie recorded a message of gratitude shared with staff and partners working in public health to keep us safe and live healthier. And that message got really great engagement. So we may do a few more videos featuring Julie and put those out on YouTube and send them out through email. On April 6th, TSET hosted a mid-session webinar to update grantees on bills making their way through the legislature. And we've already scheduled our end of session webinar for June 8th. On May 11th, Julie participated in a virtual panel about food insecurity and how hunger affects children's academic performance. Other panelists included Ryan Walters, the CEO of Every Kid Counts Oklahoma, Stacy Dykstra, CEO of the Regional Food Bank, and Chris Bernard, Executive Director of Hunger Free Oklahoma. And as Julie mentioned earlier, the Legislative Office of Fiscal Transparency has completed their assessment of TSET. We provided a formal written response to them, and the loft hearing in which they present that report will be June 21st. And Julie will be there to answer questions from lawmakers. And I'll be there and perhaps some other TSET staff and board members as well. You have any outreach questions? All right. For sponsorship grants, the most recent sponsorship grant was awarded to the Greater Oklahoma City Parks and Trails Foundation for their Go Climb OKC program. We've spent $13,000 or 54% of the $24,000 sponsorship budget. I think a lot of the lag there just has to do with the COVID pandemic. So I'm hoping to see more events and sponsorships bounce back next fiscal year. Upcoming events include the Grant Makers and Health Conference taking place virtually on June 8th, the State Chamber Annual Meeting in Oklahoma City and virtually on June 23rd, and the Oklahoma PTA Leadership Convention taking place virtually June 10 through 12. And another item of note, the legislature must adjourn sine die by May 28th. So we have just over a week left of session.
Thomas, that was wonderful.
All right. Thank you, Casey and Thomas. Item 8 on our agenda is appointment of public information specialist. And I'd now like to consider a motion and vote to enter into executive session to discuss candidates for public information specialist.
So moved, go into executive session.
Moved and seconded, roll call.
Bruce Richmond,
Yes.
Casey Gilbline,
Yes.
Susanna Gattoni.
Yes.
Marshall Slims.
Yes. All right, motion passes.
We're gonna go into this room, that room. Which room? This room to the right, into executive. session.
We're going there.
Yeah.
Okay.
Entertain a motion to enter the regular session.
So moved.
Second,
Roll call. Yes.
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 Then
Yes, so the motion would be to give authority to the Director of Public Information and Outreach to move forward with an offer of employment to candidate A, a salary not to exceed 53,000, and on to candidate B if for some reason candidate A would not accept.
Motion.
It's been moved and seconded. Thank you. Roll call. Yes.
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 Item 9, any matter not known about or which could not have been reasonably foreseen prior to the time of posting of the agenda. Is there any new business? If not, I'll entertain a motion for adjournment.
Second.
Roll call. Yes.
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 Thank you.
Nice job.
Yes.